Now, in our first story, we'll lead with the finance minister. And Ken Ofori-Atta has described as obnoxious, self-serving former President Mahama's government's energy agreement that have since seen Ghana cough up some 2.5 billion Ghana cedis annually to pay for power it does not need. In government mid-year budget review on Monday, the finance minister said this amount is to pay for some 2,300 megawatts of installed capacity, which the country does not consume. At peak demand, Ghana uses some 2,700 megawatts out of more than 5,000 megawatts in installed capacity. Ken Ofori-Atta says this poses grave financial risks to Ghana and revealed there are several other contracts on a take-or-pay basis.
Speaker, notwithstanding the significant progress we have made so far, the serious challenges we are facing in the energy sector pose grave financial risk to the whole economy. At the heart of these challenges are the obnoxious take-or-pay contracts signed by the NDC, which obligate us to pay for capacity we do not need. Currently, according to the Energy Commission, our installed capacity of over 5,000 megawatts is almost double our peak demand of around 2,700 megawatts. Notably, 2,300 megawatts of the installed capacity has been contracted on a take-or-pay basis. This means that we are contractually, Mr. Speaker, obliged to throw away money for this excess capacity which we do not consume. This has resulted in us paying over $500 million of over 2.5 billion annually for power generation capacity that we do not need. Similarly, for gas, Ghana has contracted for around 750 million scf per day by 2023. This is even after this government terminated 2 other LNG contracts in 2017. Current demand is around 250 million scf per day, and this is projected to rise to between 450 and 550 million scf per day by 2023. About 640 million scf of the contracted gas supply is on a take-or-pay basis, Mr. Speaker, meaning we have to pay whether we use it or not. From 2020, if nothing is done, we'll be facing annual excess capacity charges of between $550 million and $850 million every year. Thankfully, Mr. Speaker, we have a plan to deal with this. Mr. Speaker, we cannot allow this situation to continue. There is no doubt that the situation in the energy sector is shocking the economy. We are in a state of emergency and must therefore respond with urgency and boldness. We shall, from August 1st, 2019, Mr. Speaker, with the support of Parliament, make take-or-pay contracts a beast of the past.
Meanwhile, Ghana's renewable energy sector has been given a boost after a €5 million grant from Germany to generate power from waste. The 4-year project is a partnership between the public and private sector organizations in Ghana and Germany. The Minister of Environment, Science, Technology and Innovation, Professor Kwabena Frimpong-Boateng, says the partnership has come at a good time because Ghana's climate change efforts have been focused on putting in place suitable policies and actions.
The project will also include adequate collection and management schemes for waste in the country. Different types of waste will be separate to ensure better treatment. Special plants built to process the waste will convert certain categories to charcoal and others to gas. Environment Minister Professor Kwabena Frimpong-Boateng pledged his outfit's commitment in ensuring that the project is successfully implemented.
I'm very happy that the Minister herself is here to witness the start of another very important project, a waste-to-energy project that will solve both energy problems and environmental problems. And as he said, if it's successful, by 2040, there will be several of such projects providing energy from the range of 1 to 5 megawatts. And so the important thing is not only the provision of energy and environmental sanitation, but the research that is going on involving several universities in Ghana and then a few universities and the CSIR here in Ghana. And this interaction, knowledge transfer, skills transfer I think will help us so that in the future we'll be able to stand on our own.
Anja Kalijic, Minister of the German Ministry for Education and Research, says issues with climate change are very important, hence their intervention.
Climate change is a problem all over the world, in Germany as well as in Ghana, and we want to help each other in projects about waste usual to energy. That you can organize the waste which you have on the street and so on to collect, and then we can make energy from this waste. And that's a project at the moment we are planning together. But we have a bigger project, Vascal we call it, a research institution where we work together for climate change and using of land.
The implementation of the project is expected to have several wide-reaching impacts on Ghana, such as attaining the Sustainable Development Goals.
Well, let's turn our attention now to some mainstream politics. And former President John Dramani Mahama has promised to provide all 6 newly created regions with a regional hospital each. And this will only happen should he win the 2020 elections. He was speaking at Techimang after the inauguration of a regional police complex for the NDC, or a regional office complex for the NDC, as part of his 2-day working visit to the newly created Bongo East region. JoyNews Anasabit was at the event and our reports.
The former president and flag bearer of the opposition National Democratic Congress, Mr. John Dramani Mahama, on Monday began his 2-day working visit to the newly created Bongo East region. The tour was to officially thank party delegates and supporters for the resounding endorsement of last February's primaries, where Mr. Mahama was elected as the party's flag bearer. Mr. Mahama paid a courtesy call on the Nananum of the Techman Traditional Council, where he assured Nananum that the newly created region will see massive developmental projects during the second coming of the party in 2021. Every land has its rightful owner, so we are here to seek for your blessings before embarking on our mission. Techman has been made the regional capital, and we all know that the NDC is the party of developmental projects. So the NDC will be the party to put up structures including regional hospital and police barracks.
Regional hospital, regional police headquarters,
Akwamuhene and acting president of the Techman Traditional Council, Nana Owusu Jare, called on the former president and the NDC to ensure that the party focuses on selling its campaign messages to electors devoid of attacks.
In himself, Rafomi and Yomufia.
What I want to say is that vigilantism scares a lot of people. Two rivals will always have little issues, but when they start resorting to attacking each other with weapons, that means there is going to be a bigger problem. So let the people know what you have in stock for them. Please let your message sink to the people's hearts. Then the former president commissioned a newly built edifice that would serve as the party's regional secretariat. Mr. Mahama promised that when the party is given another opportunity to rule in 2020, the NDC will build 6 new regional hospitals across the 6 newly created regions. Reporting for Joy News, Anas Sabit, Techiman.
Well, now let's take you to the Upper East region. And the Bongo District Assembly has handed over a newly built community-based health planning and services compound. And it is a new 15-bed maternity block to 2 communities in the area to help improve healthcare delivery. The 2 facilities located at Sanabese and Namu communities respectively were built with funds from the District Assembly's Common Fund and the District Development Facility. Here's a report by JoyNews Upper East Regional Correspondent Albert Sorry.
The Community-Based Health Planning and Services or CHIPS compound located at the Sanabese community comes with a staff bungalow and a mechanized water system. It is valued at 226,000 Ghana cedis and was built with funds from the Bongo District Assembly's 2018 share of the District Assembly's Common Fund. Assembly member for the area, Veronica Ania, said, until now, community members of Sanabese had to trek long distances to other areas in order to get access to healthcare.
You have to move to another electoral area around the market side. It's very far. And then you have to go to Kavre. And if it's the rainy season, there is a small river around there. Before you cross, it's not easy, unless otherwise it doesn't rain easy. So it means that if you are sick or if you are in labor, you either resort to walk from that far distance to the one in Aukabisi electoral area, or when you are lucky and it hasn't rained, then you cross to Kavre for your child welfare service, your A&C service, and then other medical services you may need from the healthcare givers. This is actually a CHIPS compound. At least they may not be able to handle complicated issues, but at least walking to a health facility where the healthcare giver can give you the opportunity, can help you move to the next level for help. People used to either will not go because they don't have means, or they will deliver in the house.
The Bongo District Assembly has also handed over a new 15-bed maternity block built at Namo to improve access to maternal health care in the area. The maternity block, valued at 130,000 Ghana cedis, was funded by the District Development Facility. The health official in charge of the Namo Health Center, Sadia Alimatu Adamu, said the new block will help ease the frequent congestion often seen at the old maternity block.
We have a consulting room with maternity block of 2 beds, and the congestion there, when women come to deliver, at times you have to deliver, you are forced to discharge the client before their time, because at a go 4 or 5 people can come, and the space there is not much to contain them. And so with this congestion, we appeal to the District Assembly through the District Health Directorate, and with the help of the District Health Directorate, now we have gotten a new building to help us deliver quality care to our clients.
District Chief Executive for Bongo, Peter Ayembesa, reiterated government's commitment to improving the health sector and called on the Ghana Health Services to put the new facilities to good use.
Within the 4 years, we expect to do not less than 12 to 16 in the year. And fortunately, Northern Development Authority has given us some guidelines to propose projects for them. And health is very dear to our heart. So we are going to sink a lot of the resources into health, so that at least our people can have good health and live long and perform their normal activities.
From the Bongo district of the Upper East region, Albert Sorry, reporting for Joy News.
And that's it for the news tidbit we have. But we have more news as we do the review of the newspapers, front, the center spreads, as well as the back pages of the dailies. And myself and Mama Wioso Abwaji and Kojo Yankson will be doing all that. Stay with us.